attendees that will be streaming. So good morning, of course, and good evening to everyone, depending on where you are in the world right now. My name is Greg Ross. I'm the Executive Director with Canada-ASEAN Business Council. I'm based in Singapore, and we also have team members from CABC that are dialing in from Canada and across the region. We're very happy to have you with us here today for our second webinar in partnership with Tractus Asia today on building business resilience during and post COVID-19. We're very pleased to see the strong turnout today. Of course, many familiar faces to the CABC and those of you who joined us last time, and welcome to those of you who are joining a CABC activity for the first time. Just a couple quick housekeeping notes that we'll start off here with. We do ask that participants who are not speaking to remain on mute throughout the presentation and to also keep cameras off at all times if you are not a presenter. This webinar will be recorded as we will be sharing the session with our members who are not able to join us today. Also, all of our audience questions will be addressed during the question and answer period at the end of the session. So we asked all of our participants to submit their questions live during the meeting to the organizers, and we'll make sure to get through all of those at the end of the meeting. Just a few quick words of thanks here. First, of course, to John, Uday, and the Tractus team for the ongoing support of CABC and the partnership with us for the webinar today. I'd also like to thank Nikki Lung, CABC's Associate Director, for all of her hard work getting this webinar off the ground. The Canadian Chambers of Commerce and ASEAN have been very supportive of this series. The Chambers are an important partner of our organization and are generally an essential resource for the Canadian business community and the ASEAN business community across the region. So we're very grateful for their support and to have them with us. And lastly, we'd thank the CABC's founding patron member, Scotiabank, our founding patron, Canada, National Bank of Canada, and our patron members, Bank of Montreal, Sun Life Financial, Manulife, and Export Development Canada. So just turning to the agenda for today, we're very pleased to have business leaders with us from CABC members, Canada National Railway, Senescence Life Sciences, and Techneon, who will be having a panel discussion with Tractus Asia's Managing Director, John Evans, about how their firms are navigating the challenges they face doing business in ASEAN right now under COVID-19 and how they are preparing for the new normal ahead. Following the panel, we'll be having a conversation in a fireside chat with Jevity Consulting to discuss some practical health considerations for employees right now and throughout the reopenings ahead. As mentioned, the session will end with a question and answer period with all of our participants who would like to engage with the speakers. We encourage you to submit all of the questions through the GoToMeeting chat function to the organizers, and we will address them at the end of the session. So thanks again to everyone who's joined us, and John, I'll pass things over to you here for the kickoff. Thanks.
Greg, thank you very much, and it's always a pleasure to partner and cooperate with CABC. I'm excited about today. It's the second event that we've held. In the last event, what we did is we talked a little bit about the interruptions that COVID-19 was having to business. I'm going to cover a little bit of that just to give context to some of the people that may have not been on that. But the real goal today is to be able to talk about business resilience. And to do that, we want to get pretty quickly to our panel and talk to them about what they are doing and how they are doing it in this as we come out of COVID-19 and we're looking at post-COVID-19. So with that, let's head to the first slide. This is my background. I won't spend a lot of time on it. I've been in the region for 25 years. I have lived both in Thailand and Shanghai, China for almost an equal split of that. The company has 9 offices across the region, and we've assisted on about $5 billion of trade and investment for North American companies, both Canadian and US, looking at their market strategies. We're also working with a number of Canadian public sector organizations, helping them to increase trade and investment flows with the region. Next slide, Uday. Thanks. So yeah, I think when you think about business resilience, one of the things you have to think about is people. And I think the people aspect is, of course, the most important part of almost any business. And so if you think about what has happened since COVID-19 hit, and I talked a little bit in our first session about the fact that because it hit in Asia, Asia is ahead of the curve. This started in China, it rolled out into Southeast Asia, to Korea, Japan, before it really moved on to Europe and North America. And so because it started earlier, and we're further along in the economic curve, but also the viral curve, we are in a position where we're looking at, recovery faster and getting back in place. But what has that meant to our businesses? And if you can read these slides, of course, but it's interesting. Mercer Global HR did a survey of 2,700 companies, and this was in March. So if you think about March, that was really when COVID was at its peak on a global basis. 66% of those companies had closed their offices and people were working from home. That's sort of the great experiment. What does that mean? How is it going to work? And that same survey had that 80% of people were concerned about productivity dropping. So one of the things that I'd like to pose right now for the panel later, and for all of you that are listening, is, has productivity dropped? Okay, I know anecdotally from working with our clients and with our own team, hours of work have not necessarily dropped. And a lot of people are actually working more. We're all digitally engaged, like we're doing this morning, where before there may have been a seminar that you had flown to visit. It's also changed how companies are looking at their hiring and who they're bringing on. People are looking at technology. Of course, travel is almost disappeared. So we're using the venues like GoToMeeting, like Zoom, like Teams, and others to be able to connect with people. And I think I mentioned previously, one of the things that I've seen is that I used to fly somewhere to start a relationship with someone and start a business discussion. And that was sort of the initial, let's get to know each other, let's see if we can do business. That's all happening online. And I think when we get back to traveling, which is just starting now in a lot of places, we're going to see that we're going to, seal those deals or do the final negotiations or meet the person that we're already doing business with. The other thing that I think is really important is we've created a virtual global labor pool. And so what I mean by that is, prior to COVID-19, people, of course, were moving globally and being hired, and you had work permit issues. I mean, Singapore is a great example. Everybody needs an employment pass, and it's not always easy to get, and you have to have a certain number of local hires. COVID is actually going to allow companies to have home-based or alternative location-based workers that will now, because their productivity can be equal to being in an office, not need to move. And so that's going to change the dynamics on how things are done. The other thing is really how do you train, manage, and communicate with teams? And so those are some things I'd like to cover today in our panel. Uday, next slide, please. So supply chain was something we covered. Supply chains have been massively interrupted by this. Whether it is labor that has not been able to work in the factories around the world, not just in Asia, if it's the logistics that have kept moving in often cases because they've been essential workers, to get food to our tables, to get personal protection equipment, medical supplies to those that are needed in cities and countries around the globe. But what we've realized is that through this event, this black swan event of the COVID pandemic, is that those supply chains are very fragile. And there are a number of industries that have been hurt severely. And just looking at sort of one of those, the food industry has seen both positive and negative impacts. There have recently been shortages in the US because of COVID of things like pork and not being able to get it to the market. There were also shortages of eggs in China because they could not get into the hatcheries. On the flip side of that, if you're looking at delivering foods to homes or to other places where people are social isolating, the sales have gone through the roof. And so that means that both the supply chain side as well as the business has had to quickly evolve. And there was an example of one of the global hotel chains, and they were telling us that they have hotel, hospitality, and restaurants, and immediately their hotel business fell by like 90%, and they own a pizza chain, and their pizza business quadrupled overnight, and so they shifted employees from the hotels into the pizza business. And so I think the ability to transform quickly in a crisis like this is important, and then looking at those supply chains, what needs to be de-risked in the future. So one more slide, please, Uday. So the other topic we talked about last time was reevaluating your sales channels. And I talked a little bit about that earlier by meeting people. If you look across the region and across the globe, e-commerce has been growing steadily. One of the things that will be interesting to see is what happens to e-commerce in the post-COVID world. Does it mean, like we're seeing in North America now, that major retailers are just going belly up, and they were already hurting because of the impact from Amazon and other online venues, and they're now going bankrupt? Or will you actually see a return to going to the malls? And if you're where we are here in Asia, you'll know that certain countries, Singapore, even though their sales have fallen by 13% during COVID and the malls have been closed, that's not very much. Thailand, the Philippines, people like to go to the malls, whether they're shopping or it's a social outing. And then Canadians, there was a survey, and it surprised me a little. It was done by a group called Numerator, that 3 out of 10 are doing more online shopping, and it's increasing. That seems like a pretty small number. And if you look at the inability to go places, you would think during COVID that would even increase faster. So, it really begs the question: as Canadians, are we looking to go back to the mall, or will it really evolve into e-commerce? So these are other things I think that you really need to think about. How do you get your goods, products, and services into the markets most efficiently in this new normal? Next slide, please. When we get to our fireside chat, we're going to talk about healthcare practices. And I think 3 things that are really important to call out is: what is our world going to look like, and how do businesses adjust to COVID-19? And of course, a lot of that is going to be impacted by when there is a treatment and when there is a vaccine. There tends to be a lot of talk about the rapid development of vaccines, but a little less talk about the rapid development of effective treatments. And, Emirates Airlines launched already more than a month ago actual, COVID-19 blood testing. It's a 10-minute blood test where you will be tested as you're sitting in the airport terminal in a properly socially distanced location, and then you either get on the plane or you don't based on your test results. Masks, will stay a trend. Now, while they've been adopted for a long time in Asia, and I think Asian nations have been a little bit more conservative, but also a little bit more considerate of their fellow person, that when they're ill, they wear masks. And in North America, that's not necessarily the same. But we're seeing mask development go from surgical masks to disposables, moving on to washables, and now fashion masks. And everybody's sewing masks at home, but we actually have several clients that are actually making masks in the not tens of millions, but hundreds of millions of units that they believe will go on for a long time. And then going back to work, I think this example of the Chinese doing the social distancing is really relevant, because how things are happening, these people are eating lunch. And that's what lunch is now looking like in a factory from social distancing. So I'm excited about hearing our experts' discussion with Dr. Pierce on this. So with that, there are our offices. I'd like to wrap up, and I'd like to move on to our panel. So if we could get the panelists to turn on their video screens.
And John, I'm still having some difficulty with that. My apologies.
No problem. No problem. I can understand that. So first of all, I'll quickly introduce our panelists. Mr. Gabriel Lagunas is the General Manager for Asia for the Canadian National Railway, and we're excited to hear what CN is doing, and you know, have some specific questions to learn. You know, what does CN do in Asia, and how has it been impacted? Dr. Sean Watson is the CEO of Sensense, a life sciences company. And we're extremely interested to look at and hear from him how his company is developing as a smaller company. I think somebody needs to mute. We're getting a little bit of feedback, so if you're not speaking, if you could please mute. Thank you. And then Terry McAllister, who you can't see, is the president for international markets for Technion, which is a maker of workplace furniture. And of course, that is a business that, as I was just discussing, is probably going to be really impacted, and it'll be interesting to see how things change. And so with that, welcome, gentlemen. I'm very happy to have you here. I think that I'm going to start, Gabriel, with you. And you know, one of the things that I'd like to ask is, you know, how has CN addressed safety with COVID-19 along its network?
Yeah, thank you very much for having me. Like I said, my name is Gabriel, and I'm the General Manager for CN here in Asia, advancing the business development agenda that CN has in the region. We have customers here in the region, our customers of customers and stakeholders. So my mandate is to keep in touch with them, actually to help plan from the get-go, rather than, you know, once landing in North America, we kind of like advise as to what best to do, how best to route to places like Chicago, Toronto, Montreal, Detroit. At CN, of course, we were hit, you know, on the supply side, because we also are a purchaser of services, of products, and we're also, you know, we supply to our customers. We were also hit as well when the crisis reached North America. I myself, to your point, I was here in the thick of things here in Shanghai in February, early February. So I lived through that in China the month of February, and then have been, you know, giving some tips and hints to my colleagues back in North America since mid-March, when the crisis started to escalate in Canada and the US. When you know, very early on in the crisis in North America, we actually established a cross-function working group with subject matter experts from different departments. One of the principles that we followed is to respect and the guidelines provided by our health authorities. Another principle was to respect the guidelines provided by different jurisdictions that we cross-trace in the nation, that be federal, state, or province regulations. And of course, the most important one, or actually, you know, one of the 3 points that we have, is to provide a safe and healthy and clean environment for our workers. So with this cross-function group, there were a number of, there still are a number of us, maybe 20 people representing different functions. We started to implement some policies and guidelines according to each workplace. As you may guess, we have accounting in our, you know, in our midst, but we also have terminal operators. So what may be applicable to one department may not be applicable to the rest, but there are some basic rules that we're following. One of them is social distancing, you know, the washing of hands, and the masks as of late in the last few weeks that was implemented in the US and Canada. All of this really just to keep the railroad running. Very early on in the crisis, the different authorities in the US and Canada deem transportation as an essential service. So we understood the role that we have in keeping the economy moving, keeping some of the essential goods moving, such as chemicals to make the water drinkable, plastics, and all the raw materials to create masks. So we are very proud, and we are very humbled to say that I believe we've done a good job. We are speaking to our customers on a daily basis, on a weekly basis, to plan for what they need. So we've embraced this in a safe, healthy manner for our own employees and for our customers as well.
Thank you, Gabriel. I think one of the things you just hit on that was really important is, CN is, of course, is essential. So the shipment of goods being essential and the workers being essential. It makes me think about something that Dr. Watson, that is, not only essential, but absolutely necessary and needed. And so, from your perspective, being in the life sciences, how has COVID impacted your business with clinical research and development?
Sure, thanks, John. Great question. It's one of the things that you don't hear too often on the news, I would say, is how it's affecting the longer term rollout of different medications in clinical research. So our company, maybe just a quick background to us. So we're a neuroscience-based company. We focus on brain health from commercial products that are made in Canada and sold all the way to pre-commercial research and a pipeline focused on the prevention or slowing down of Alzheimer's disease. So when you talk about clinical research and how it's impacted us, or how COVID's impacted us, that's one of the worst hit parts, I would say, in our business. We're very heavily dependent on research and IP development, but our research focuses on the most vulnerable. So when you talk about Alzheimer's, you're talking about patients with a lot of comorbidities, you're talking about patients who are high risk. And when you go to ethics boards around the world, not just in Singapore or Canada, they always look at the risk to the patient, to the potential rewards. And so what we're seeing now is there's a big drawback, and governments don't know what to do. Ethics boards don't know what to do, because these at-risk populations is what we need and want to study. So right now what we're seeing is just a halt. So there's no more approvals happening, particularly in Singapore. We're seeing kind of a stop to the start of these clinical trials. And so for a pharmaceutical-based company, that's a big hit, because you're spending money to get this research done. So how are we navigating it? Well, right now we're just waiting out to see how the governments respond and how these ethics boards and medical advisory councils respond to it.
Thank you. Terry, a question for you. You're a manufacturer in the Asian region, and you're in a segment that I think has two really interesting potential impacts. One is what's going to happen with the workplace, okay, which is the secondary question, and we'll get to that maybe a little later. But the first question is, how was your manufacturing impacted, and what were the best practices, or what did you do to make sure that you were resilient under COVID-19?
Yeah, thank you, John. And good morning, everyone, and good evening. I'm calling in from Chicago, and I apologize for the technical difficulty that we're having here, but I appreciate the opportunity to speak with you. Technion is a world leader in the design and manufacture of office furniture and textiles and architectural products and so forth. We've been in Southeast Asia for over 25 years. Our Asian headquarters is in Malaysia, actually, in the Klang Valley outside of KL, and we operate really all across the region. And you said this earlier, John, the pandemic, I'm not sure we saw it coming, just like everybody else didn't necessarily see it coming as well. But once it hit, we sprang to action, and we drew upon our core values as a company to really guide us through what it was that we needed to do. So we, I want to say it was early March, we closed our operations temporarily, suspended our manufacturing, and sent everyone around the world, to their home offices to shelter in place, but very quickly implemented a plan to reopen. We too were an essential service, our Canadian operations in particular, because of one of the lines that we do make has some medical implications as well. So under that pretense, we were we actually were allowed to stay open, but we chose to close just temporarily so that we could assess what was going on and put the proper PPE into place and the right protocols and so forth. And so within about 2 weeks, we invited people back to work shortly after we had closed, and I'd say we're across Canada probably 95% operable from an operations standpoint. In Europe and in Asia, we're 100%. So it really didn't impact us, to the extent that possibly it could have, or with other businesses. And you're right, we're in a really exciting space right now. I've been in this industry for a long time, and I think this may be one of those times where, we're going to see a major change take place in the way in which people work. For office occupants, the return to work is complex, because it's sort of, if you imagine just your own personal lives, it starts with the flow of starting from your home, navigating through town, entering a building, getting on the elevator. Workplace is part of that puzzle, and office furniture is a subset of that. It's a much larger sort of real estate, urban planning, and transportation challenge that is all being looked at right now. So furniture has always been about, design applications, applying the right settings to support people at work. And probably everybody knows that in recent years, collaboration has become important, so you see, Google facilities, for example, or others, Apple, and even in the financial institutions, you see everybody working in a much more collaborative and social way. And so the question is, coronavirus put an end to collaboration as we know it? Will everyone work from home from now on? From listening to our customers and their design consultants, we don't think so. We think it's going to be some return to some level of normalcy, but it's going to move forward at a slower pace. Right now, there's a lot of demand for screens, temporary partitions. I don't think we're going to go back to the old cubicles. Though, that would probably in this situation probably come in handy, but no one's quite asked for that. But some variation of the use of screens and temporary things of that nature. And then I think work shifts, to de-densify spaces, that sort of thing, they're all going to be put into place. And so it's fascinating to work with these companies. We don't necessarily come in and prescribe, here's the answer and what you ought to do. But we're doing a lot of listening, and we're students of just sort of understanding what's going on, and we see a lot of change occurring, that's for sure.
Thanks, Terry. That's just got to be an exciting space, because while this probably has had a negative impact, it's also, as you said, it's getting you to look at redesigning, and you're going to have whole new product lines post-COVID that are going to be launched and rolled out to meet workforce needs. And so I think that would be exciting, as you said. Dr. Watson, I'm curious how your sales channels, distribution channels have been impacted as you're exporting these products, from Canada into ASEAN under the COVID scenario.
Sure. Yeah. Thanks, John. So on one side of our business, one of our subsidiary companies has a product made in Ontario that does go to countries here in Southeast Asia. How has it affected distribution? It really depends on the channel. So for example, in Singapore, we sell through physicians. So it's a nutritional product, but it's sold through doctors. That channel's virtually dried up. So you can't have salespeople going to clinics anymore. The doctors are focused on different things. Patients don't want to go to clinics. They don't want to put themselves at risk, even though Singapore has quite low cases still within the community. So that we see an unfortunate big downturn. In other markets, though, where it's more brick and mortar stores, we see kind of level off of sales. So Myanmar is sold through pharmacies within hospitals, but those sales are continuing. And in other markets too, we sell in Thailand, and it's online, and those sales are skyrocketing. So the disparity we see is really dependent on the channel we sell. Getting products to the region, we don't have any problems with that so far. Thankfully, all the manufacturing and supply chain in Ontario to get it here seems to be intact. It's just once it's here, we're seeing quite a bit of differences in how it's actually rolling out in the market. Also, responses of the governments are very different. So to other SMEs on the call, one thing you need to pay attention to is the news, because in ASEAN, we call it a region, but the countries are so different. So for example, in the Philippines, they've shut down all registration of brand new products. So in our business, that just closes a complete market for us for the foreseeable future. Whereas other markets like Thailand, it seems kind of business like usual. So I will say it's we have to take it country by country and news release by news release. But the good part is the global supply seems to be good, and Canada is keeping up with what we need.
So thank you, and that's good news. That's really good news to hear. Gabrielle, a question for you. You talked a little bit about CN and how it's running and what it's doing and how it's dealt with COVID. I'm curious more from a CN perspective on Asia. How is this pandemic impacting your business strategy for Asia, or how has it maybe changed something that you're looking at doing in the region?
Yeah, actually, that's listening to Dr. Watson was a very brought back memories of something that happened recently. A pharmaceutical company in Japan usually sends their products by plane from Japan to Ontario. And actually, as you know, because of the demand of PPE and the low supply of flights, the price point for the air freight for that particular product made it very expensive for this particular pharmaceutical company. So they approached one of our customers, one of our shipping line customers, and they said, hey, we know that CN has a reefer service that we can send this product on a refrigerated container that belongs to our customer. And they said, we want to run a trial to see whether the transit time and it's going to be competitive in terms of the shelf life of our product. And we helped our shipping line customer help their customer shipping from Yokohama to, I think it was Vancouver, and then furtherance to Ontario. And actually, they were quite happy. The price point was much more acceptable, even than the regular freight price for the air on the normal circumstances. So they're looking at switching actually their supply chain from going from air to an ocean and railroad transportation. So this is just one way that we're helping our customers, again, find alternatives. Another way that we're doing it is especially for ASEAN economies that they try to reach Chicago or Toronto. You'd be surprised that in terms of transit time, I'm not talking so much about distance, but in terms of transit time, we're equidistant to ship from Singapore, from Vietnam to Chicago over the port of Halifax on the East Coast, or over the ports of Vancouver and Rupert on the West Coast. It's about 34 days. The difference is a longer ocean transit and a shorter rail on the east side, and a shorter ocean transit and longer rail on the west side. But at the end of the day, it reaches Toronto, it reaches Chicago in about 34 days either way. So some of our customers are opting to ship out of Singapore, out of Vietnam, or Thailand over the East Coast because it provides a little bit more of ocean transit time. It's basically kind of like storing the product in transit. Still, our business is down, really, just because the demand is down. As you know, a lot of the demand is driven by consumers in North America, and our business is down anything between 15 to 20%, and all of this is just temporarily. We believe that we have hit bottom in May, and then June will be a little bit of a recovery, and some of our customers are thinking that Q3 will be much better than Q2 was. I think that this will depend on whether there's a second wave or third wave, or how people will react to going out now that the restrictions are being lifted in terms of the lockdowns. But I think that so far we believe that the worst is behind us.
Thank you, Gabrielle. I'm going to do one more question to you, Dr. Watson, and then I'm going to end up our moderators with a question for all of you to answer. But Dr. Watson, one of the things as an SME and somebody in the life sciences, I'm sure that you've gone through the fundraising cycle. And I'm wondering, right now it's an interesting time. 2019 had the single largest capital raise ever by private equity groups. So there's a huge amount of money sitting on, dry powder, as they call it, sitting on the sidelines. Have you seen that there's a pathway to getting funded in the life sciences, or perhaps as your role as the SME chair for CABC, do you see other companies that are finding access to this under the COVID auspice?
Sure, yeah. Maybe I can speak to senescence first. So we are looking to raise capital. We won't stop for a long time. I wish we raised it back in September, probably. Talking to some of the investors, and we have a few that we follow for quite some time now. Is the money out there? Yeah, I think you're correct in that. The interest level is there. I think what's changed quite dramatically, though, is we expect to take a haircut on valuations. Whether or not your business is horribly impacted or mildly impacted by COVID, I think the funds and whatnot will be looking to use it, I don't want to say as an excuse, but as a business owner, that's what I'll call it, to try to push down those evaluations. So we'll probably have to go through that. What we were targeted before will be lower. From what I hear from other SME members and just colleagues also in a similar space with their own companies at the same kind of Series A level, they expect the same thing. So is there cash still available? Yes, but I think as business owners, we're going to have to accept the fact that people are going to try and push down evaluations and use the current situation.
Yeah, I think that's consistent with what we're seeing, and I think as business owners, any entrepreneurs that may be on the call that are looking at funding to help to launch products or services or technologies into growth markets like ASEAN, need to be thinking that decreased valuation is probably okay, because what it's going to result in is a funding that's going to get you the growth as these markets come back. So what I'm going to do is I'm going to end on a question for all three of you, and I'll start with Gabriel and then go to you, Dr. Watson, and then on to Terry. And it's the question I raised when I first spoke that came from the survey, and it was, as we've gone to a more work from home scenario, and I know different businesses that'll be have a different level of that, particularly yours, Gabriel, is not as much, but are you seeing the concern that survey showed that more than 80% of the people are concerned productivity is going to drop? Has productivity dropped? Has it not? Just a quick answer on that.
No, it hasn't dropped at CN. We have approximately 25,000 people in our workforce. 20,000 of them are unionized. And as you can understand, that work has to be done at their workplace. The other 5,000 people are management employees. Most of them, I would say, a high percentage of those are working from home, and we haven't seen a drop in productivity. I was one of the first workers working from home. As you know, the lockdowns in China started January 25th, Chinese New Year, and then the Chinese New Year holidays were extended a few more weeks. So we work from home, and there was a concern first, not so much about the worker themselves, but about the tools, about the extra workload that the family, spending time with the family, would have on the worker, right? What their well-being. But we have been able to work with all our employees to be cognizant about their challenges that this has brought with them, and we haven't seen a drop in productivity.
Thank you. Dr. Watson?
I would say we have certainly seen a drop in productivity in our company. I don't think it's related to necessarily working at home. I think it's trying to understand the new job descriptions. So your traditional salesperson now is having to work with something they've never done before. Going to doctor's office is what you used to do. Now you can't anymore. So drop in productivity, certainly, but I think it's more trying to adapt to the job roles and realizing what we can do to push forward.
And a follow-up before Terry goes, do you think that there will be an evolution and that productivity will come back under those new scenarios and those new job descriptions, or do you think, from a corporate perspective, you're going to need to make some changes?
I think it will eventually. You're talking about an industry, though, that's deeply rooted in certain traditions. Doctors expect sales reps to come into their office. So now for task that doctor to spend an hour a day listening to Zoom calls, that'll be a big behavior. But doctors do rely on the pharmaceutical industry or the biotech industry to learn about new drugs, to ask questions and all that. So will they change? Yeah, I think the behavior will change, but it'll just take more time.
Great. And Terry, same question to you.
You know, we entered the pandemic with a very strong backlog of orders and business. And, you know, we're tied to the building industry, right, which takes a long time. There's a long lead time to build a building or to fit out a space. And so we haven't really missed a beat. So from a productivity standpoint, I would say that we have been very strong. But candidly, we can't really see what's coming in 2021. So there's been less projects on the board, so to speak. Less planning for new projects that will happen 2021, 2022. And that's the part that I'm more concerned about. So, you know, has our productivity dropped? I don't think so. Will it drop? It's hard to say. It's hard to say. I think we'll finish 2020 strong, but I'm a little worried about 2021.
Thank you. Very forthright answers from everyone. Interesting, different answers from all three on the same question. And it sounds like it's yet to be determined to see where the productivity of this new norm of working from home is going to land. So I want to thank all three panelists, Gabrielle, Dr. Watson, Terry, for your inputs and comments today. Hopefully it's been very useful for the audience, the attendees that are listening, and how you've dealt with business resilience and how you've strengthened that under the evolving COVID scenario and the unknowns that are coming with the changes of COVID. So thank you very much. We'll take a minute here, and we're going to invite Marty Pierce, who's a partner emeritus and director at Public Health Solutions of Gevity Consulting. And hi, Marty, how are you today?
Hi, John. Yeah, good to see you. Thank you very much for having me. I'm good, thanks.
Good. Why don't you, as we start, why don't you talk a little bit about your company and consulting practice and its focus?
Sure, thank you. So I'm a public health epidemiologist by training. And Gevity is a health and life sciences based information management company, headquartered in Canada, operations in US, Pacific, Europe, Southeast Asia, the Middle East. And we have focused over the last 25 years basically on implementing public health solutions in the communicable disease control space. And certainly we're quite involved in the SARS outbreak in Toronto in 2003. You know, the first real taste for most of the world of kind of the situation we find ourselves in now. And we've also been very fortunate to be involved with public health information system deployments in various countries, including in Saudi Arabia, where of course they've dealt with the Middle East respiratory virus over the last 10 years or so quite successfully. I think that's a real success story in terms of containment. A little bit different focus because it is much more acute care focus rather than the community spread we're seeing now. But we do, you know, have quite an experienced workforce in these settings, and we've been very involved with our Canadian clients as well as our Middle East clients in helping them respond to the COVID situation.
Great, thanks. My first question is a little bit of a loaded question, and it comes from the first slide that I showed that showed the viral curves across the Asian nations. You know, and some of them were being flattened quite quickly if you looked at the data, and others were actually going in the opposite direction. And so, you know, looking at those, the obvious question, I think both in Asia and in Canada, is how long will this last? And so, you know,
Yeah.
Can you talk about that?
Certainly, and you know, I guess the reality is that, you know, COVID is here to stay. So we're probably looking at, you know, the next, you know, 12, 18 months and beyond with, you know, with the types of situations we've been dealing with. Up until, of course, you know, we're successful finding a vaccine. That you know, a lot of people hanging their hat on that, and we're very hopeful. There are quite a number of candidates out there starting to move into human trials. But until we get to the point where we have an effective vaccine and we can prove essentially that people do develop immunity from it, we're going to be in a situation requiring the social distancing and the changes that we've had in place for the last couple months.
Okay, thanks. Yeah, the uncertainty, I think, is cause for concern for everyone, not only from a health standpoint, but from an economic standpoint. And my next question really revolves around sort of that second issue. And I had on one of my earlier comments on the slides was that in Asia there's been I think there's been an approach very different where people are wearing masks and they're being conservative in their approach. In North America, that's not necessarily been the case. And so, one of the questions is, when does it get back to normal? When can I start traveling? And then what do I need to do? Do I need to wear the masks like I showed on my slide? Will there be testing at airports? What do you see evolving as we get back to a more integrated business world in traveling again?
Well, certainly the very basic things are what people need to be doing now. Of course, hand washing, not touching your face, to the things we've heard from the very beginning of this situation. Social distancing, of course, keeping that space between people. And where you cannot do that, then certainly a mask is recommended now in those situations. And the reality of the airline industry now, certainly Transport Canada requiring a mask in that situation. I mean, it's always close quarters on the airplanes, even if they're able to leave seats between people. So masks and hand sanitizers in that situation is probably the reality for the near period, again, until that vaccine is able to be administered and distributed far and wide. Staying home if people are not feeling well, I think that is something that has to be reinforced for people. If you have symptoms, if you have family members that have symptoms, then you should not be going into the office, you should not be traveling. Self-isolation is still the key there. And we know that employers have to be able to support that situation as well. So, we're a lot of discussion now between the federal government and provinces in Canada about paid sick leave and finding ways to encourage people to stay home in situations where they should not be outside.
Yeah, that's a really interesting comment, and I can just speak anecdotally from our offices across Asia. One of the things that we've seen is that we, because of these best practices and mask wearing and hand sanitizing, we have seen fewer incidences of people actually being ill and coming to the office. And it's not that they're contracting COVID, but I don't see the colds. We don't see people missing days of work and now it's a very limited time span because many of our offices have been only open in Asia for the last few weeks. But I just thought that was anecdotally interesting. I do have a question for you. You talked about Jevity's global presence and having been involved in other epidemics and pandemics across the world. And I'm curious from a public health agency standpoint, where do you see the public health organizations, whether it's at a country level or a community level, being able to manage and address the issues under COVID? Are the Canadian municipalities, are they prepared? Are they doing it well? Are there best practices from a public health standpoint that you could highlight?
Well, there certainly is a fair amount of variability between countries, and even within countries, we see variations at state and provincial levels. I think the key for corporations and businesses, whether they're located in North America or in Asia, the key really is that it's quite difficult, I think, to take a national or a state level risk assessment done by a public health agency and apply it at a community level. And of course, that's where your staff are based. They're in individual communities, moving within that community, going to the grocery stores, and then potentially coming into office or business environments. And I think it's really important for all businesses to have a good handle on what's happening in the communities where their employees live and where their operations are. And so we've been working with several large Canadian energy sector clients, as well as biomedical organizations as well, trying to help them get a real sense and understanding of what's happening in the communities that they work, and actually providing them with risk summaries about active cases, about hospitalizations. It's about establishing what the transmissibility of the virus is, what's happening transmission-wise in those communities, how vulnerable those populations are. So are there a high percentage of seniors? Are there people with a high percentage of medical risk factors? And what is the resilience level like in those communities? So are the public health organizations capable of doing the contact tracing that needs to be done, the testing that needs to be done, and in making sure that they can follow up on people who go into quarantine to make sure that they are complying with the quarantine and not getting sick themselves. So there's definitely information available to businesses. I think businesses should be establishing a relationship with local public health entities in the communities that they work, so that they can get up-to-date information and use that to inform their back to work phases, essentially. So we're seeing some of our clients putting in 3, 4, 5 stage back to work, a phased approach, some of it reflecting what's happening at a provincial or national level, and using the community assessment information to determine when it's safe to move between the phases. And that seems to be, we're just starting now with companies starting to move into phase 1 and starting to think 2, 3, 4 weeks into the future of when they can move into the subsequent phases based on what will happen with the progression of the outbreak.
Marty, you just talked about sources of information from your community and from your public health organizations. I think one of the questions that I would like you to comment on is there's so much information as well as misinformation out there, whether it's social media, whether it's the real media, and in how can Canadian companies looking for information sort of sort through what are the best sources of information as they're thinking about their business in Canada as well as in ASEAN?
Well, certainly I think going to credible sources is key, whether that's the Public Health Agency in Canada, US Center for Disease Control, Singapore Ministry of Health, World Health Organization. All of those organizations have criteria for return to work in different industries, and establishing what is needed generally and specifically for the industry that you're working in. There are information sources available. Going to those organizations and taking some of the criteria that they have. It's important for any business, though, to make sure that you've taken that criteria and actually developed a written plan for your organization. Perhaps it has phases that you're thinking about moving through and the different types of public health interventions that you might need to apply within your organization. Things like social distancing, like hand washing, having sufficient hand washing stations. Maybe you're not, as you saw in the picture of people eating lunch in China, you may have to adjust your cafeteria or lunchroom practices, your coffee room practices. Having a written approach, though, is very important, and there are certainly resources out there and companies like ours willing to help you work through the details of those and to implement them.
Thank you. If our panelists are still on, if any of you would like to rejoin, we did just get a couple of questions from the audience that have just come in, one of the questions from the audience was just what creative things have you either done in your organization to increase business productivity with COVID, or to deal with COVID, or in your case, Marty, to advise the companies? Is there anything that you could comment on that is innovative that you've done, or innovative or creative in the current environment? And I'll just throw it out there to the panel if any of you would like to answer that.
Yeah,
sure, maybe I can. Oh, go ahead.
Thank you. In our case, we don't use Zoom. I mean, I've used Zoom when I've been invited to some conferences. That relates to the question that we have from the panel. We've used Microsoft Teams, but you know, I hardly would consider that innovative. I think that a lot of companies are using that, but actually, it's proving a very useful tool. We like it a lot. But in terms of our employees themselves, some of them, for example, as you know, some people have had a lower work, just people in sales and things like that. And we've talked to them, and they've actually put out snippets, perhaps a 5, 10, 15-minute video for carrying a nursery for those of our colleagues, for example, that have to work and there's no nurseries or primary schools. So they've done reading, video reading, with the children. Some of our colleagues are doing. We used to have in Montreal, we still do a gym, but who knows how much longer we're going to be able to use the gym at this stage in Canada. So some of our colleagues used to provide free classes at the gym, on site, and we've worked with them, and they're doing some of that online and streaming it within the company, again, just to keep our people engaged. Are these innovative compared to other companies? Perhaps not, but I think it's the first time that we're doing it, and that's just one way that we're trying to cope with this.
Thank you, Gabriel. Dr. Watson, would you like to add anything?
Sure. Yeah, maybe on that vein is the use of Zoom or teleconferencing. When I talk to other SMEs trying to get into the region here, one of the things we always used to preach is you have to come to Asia to do business in Asia. People expect you to come and have the face-to-face interactions, which I think you alluded to earlier, John. What we've seen over the last number of weeks, though, is the reception to using video conferences is much higher. So now contacts in Vietnam, Malaysia, Philippines, they're willing to get on Zoom calls and talk to us. So maybe to the SMEs on the call, it could this move to Zoom could be an innovation in the sense that it's going to open up opportunities in Asia that I would say before COVID wouldn't have been successful. Just doing a teleconferencing before this, low chances maybe to develop that relationship. Whereas what we're seeing in our company is that people are willing and excited to have Zoom conversations. And so that maybe cultural barrier before is maybe lowering a bit.
Thanks. Terry or Marty? Yeah, Terry.
I was going to agree with Sean as well. I think that this, just using the term Zoom generically, but whether it's Skype or Zoom or Hangouts or whatever, however you want to frame it, that's here to stay. I think the younger generation, like my 16-year-old daughter, she never calls me unless it's on FaceTime. She never picks up the phone and calls, just voice. But I think other generations or maybe other cultures are less comfortable with that. Well, I think what we've gone through the last 90 days, I think everybody's comfortable with it. And in fact, I think we've seen that there are some real things that you could do that maybe otherwise you wouldn't have done, or you would have maybe done it in a less, you might have delayed it. For example, we sell through dealers. We work closely with architects and designers, and we work with major clients. And we've engaged them all through this period. There's been no lack of engagement. So we've put on training. Like every other week, we have a training program for our dealers in the Middle East, and we have over 60 to 70 participants that we never would have had before. We would have felt like we would have had to go to their dealership and brought in, coffee and donuts and try to convince them to sit and watch a PowerPoint. Now we sort of do it electronically. We have some fun with it, and the level of participation actually has been surprising. Same thing with architects, continuing education programs, which are important to that industry. We've been able to provide content for that, which allows these designers to continue with that. We have actually taken a couple of our showrooms, like our Toronto hub and our Chicago showroom, and have created a 3D walkthrough so that when clients can't come now to our showrooms, we can bring our showrooms to them. And I mean, there's some obvious differences between walking through a space and flying through a space, virtually, but it's some content that is creative. And I guess lastly, we've created some online stores. We don't have outside of Canada, we don't really have a place where you can buy our furniture online, but for client-specific purposes, clients that have a standard of Technion furniture, we've been working with them. In fact, some in Singapore, in fact, where we've been creating some online platforms for their employees to be able to upgrade some of their home furniture to height adjustable tables and other kinds of things that maybe they only had in their offices but didn't have at home. So we've tried to leverage this technology. We haven't seen it as something evil. We're sort of saying, hey, let's embrace it. In fact, I think we can do more and do it faster and do it maybe sharper than we could have prior.
Well, before we turn to Marty, I certainly need one of those because I put my computer on a stack of books when so that it's at the right level. But Marty, any comment?
My secretary's on the call, so I know that they're going to be calling you shortly.
Okay, great.
Great. That's good. I do have one that I do find quite fascinating. We have a partnership of social scientists, public health people, and office space planning, office tower planning, really, using a machine learning and artificial intelligence approach to map out the social distancing pinch points in large office buildings. And, basically an approach that takes the blueprints, if you will, the plans for an office tower, feeds them into essentially a machine learning robot and helps to define and visualize the tight points where you might have hallways where you can't keep social distancing. Certainly things like elevators that are notoriously going to be difficult, I think, to keep people apart. Some of the industrial spaces that we've worked in, trying to make sure they can be redesigned to allow for distance between people. That's one of the most interesting things and novel things I think that I've seen come out of COVID at the moment.
Thank you. So we're kind of at the end of our time. We ended on that question on innovation, which I think is a very interesting one. And what I really heard is whether it's CN innovating just by doing something that you haven't done before, even though it may not be that innovative, across the spectrum of the four of you there, to machine learning, which of course is very innovative and sort of at the cutting edge of technology, is that innovating and changing your business models is something that all companies are doing to look at how to address the COVID situation. There are a few other questions, but we're at the end of our time. And so I want to thank the panelists. I want to thank all of you for your participation. I want to say that we're going to have one more event. It's in the next couple of weeks. And one of the things we are looking for is we're looking for diversity in our panelists. We're looking for different presenters, different business scopes, different scales of business that are doing things between Canada and ASEAN. And so if you have something that you think is really interesting and that is would be of interest to a larger audience, please reach out to Nikki or Greg. And with that, I'll turn it back to Greg and thank you all for your participation today. It was very enlightening. Thank you.
Thanks, John.
Thank you.
Thanks, John.
Thanks very much, John, for your great job leading this panel again today, and thanks so much for Tractus's support for the webinar series. Marty, Sean, Gabriel, and Terry, we really appreciate your time taken as well to join the call today, share your experiences and your insights. By nature, CABC really is a platform for the Canadian private sector in ASEAN to have the type of dialogue that we did today to help one another's growth and the overall trade relationship. So I'm sure that many of our panelists really appreciated the insights that you shared. And if there are further questions, we'd be happy, of course, to connect any of the attendees with the panelists so they can take those discussions further. As John mentioned, over the months ahead, CABC will be continuing to deliver virtual opportunities for leaders across the Canada-ASEAN network, and looking at the key topics that will shape the relationship in the months ahead. So we encourage everyone to watch for more details on upcoming series, and to follow CABC on our social media and our newsletter if you're not already connected with us there. And I believe we'll be sharing the details for that in the chat here. And of course, on our side, Nikki and myself are happy to talk to companies or organizations anytime to see how we can work together in the months ahead, particularly on the virtual series that we have on the go. So with that, we're at the end of our session. So thank you again very much to everyone for joining us, and we look forward to seeing you again soon.
Thank you, Greg.